Hi, this is Gabby. I'm here with our patient, Ms. DeRoche. She's here to talk about her experience. So we saw her back 7 years ago, back in 2013, when she first came to us for a left wrist fracture. Then 7 years later, she came back because she had a right wrist fracture. She is 2 weeks and 4 days from her right wrist ORIF, and she's here to talk about her experience with both wrist surgeries. Go ahead.
Hi everyone. So this is my first time doing this, but I just can't say enough wonderful things about Dr. Cohen and his staff. So 2013, I fell off my bike and I broke my left wrist. I was in Bishop, so too far away to come in right away to Dr. Cohen. And they did some x-rays and they said, oh yeah, you broke your wrist. And they said, well, we can do surgery here. And I said, no. I knew a doctor in Westlake that would do a really good job. So my sister-in-law had done some surgery with him and just couldn't say enough things. So we went in, had the x-rays done and had scheduled surgery pretty much right away and had that surgery done, and it turned out great. I was mobile right away. Everything was working great. And so, anyway, I had the surgery done in 13, and I think a year later we took the plate out. So, everything's working great with my left hand. So, lo and behold, I now live in Washington, and I'm here on vacation, and I came to visit my kids, and this time I fell and broke my right wrist. So right away, I didn't even go to the emergency room because I was a patient of Dr. Cohen's already. They made time for me to come into the office, so I was able to see him right away. Did the X-rays, and it was so funny. He walks in the door and he says, "Are you kidding me?" Because here I am again, and I took the ice off, and he looks at my wrist and he says, "Well, I don't have my x-ray eyes on, but I can tell you right now, that's broken." So anyway, we went and did the x-rays, and that was on, I don't remember what day, I think it might have been a Monday. And he scheduled surgery right away within a week, and had the surgery done, and it's now been 2 weeks and 4 days. I never had, I think because we got in right away, I was able to move my hands pretty well right away. But now, within 2 weeks, there's only a teeny little pain on this side. But other than that, it's working really well. So the incision looks great. I still can't believe it's been 2 weeks.
So this is the right side incision that was done 2 weeks and 4 days ago. This is the one that was done 7 years ago. And how was your pain right after surgery?
So interesting enough, once the block, he did a block, once that kicked in, there was no pain for more than 24 hours. In fact, I did a no-no. The night of surgery, I actually felt really good and started chopping vegetables, which I shouldn't have done. But it was great. And then I think the next day I may have taken half a pain pill. I took 2 days where I took half pain pills. The pain was not bad. And
you're working next door with therapy, correct?
Yes. Oh gosh, the therapies. That was the other thing. Dr. Cohen said, I will do the surgery, but you have to promise 2 weeks of therapy here. So we stayed here, and because it's my right hand, I know how important the therapy is here, and so we stayed for 4 weeks. I've got 1 more week of therapy, and then we're done, and we'll do some therapy on the scar tissue. And
do you want to show everybody your range of motion, praying up?
Yes. Okay, so both hands. So making fists, and making this way, and this way, and this way, and this way, and this way.
And then the praying
and
up.
And the praying one. Was right there.
Good. And then the praying down.
That one's this way. I haven't tried that one.
Palms together, both of the top of the hands together down.
There. Oh, this way. Sorry.
It's okay. Perfect.
There we go.
All right, so I'm going to show everybody your x-rays of what the hardware looks inside. So that's her hardware. All right. Perfect. Well, thank you so much.
Thank you, everybody, and don't hesitate to come back to Dr. Cohen. Even if I had broke it in Washington, I would have flown back here to get the surgery done. That's how much I trust him.
All right. Perfect. Thank you.
Thank you.